3 specific myths about sports physiotherapy are keeping injured Malaysians in pain longer than necessary, and all 3 are wrong in ways that are straightforward to demonstrate. Let me address each one directly with the actual clinical facts. Myth 1. You need a referral from a doctor before you can see a sports physiotherapist. This is the most widely believed misconception and the one that causes the most preventable delays. In Malaysia, physiotherapy is a direct access profession regulated under the Allied Health Professions Act. You do not need a referral from a general practitioner, a specialist, an orthopedic surgeon, or any other healthcare provider to book and attend a physiotherapy appointment. You can identify a clinic, call or book online, and walk in for your first appointment without any prior medical consultation. There are 2 specific situations where a referral legitimately adds value. First, when your condition is diagnostically unclear and might benefit from imaging that a doctor can order. Second, when your insurance requires a referral letter for claims processing. In both cases, the referral is a practical tool, not a clinical prerequisite. The absence of a referral should never be a reason to delay treatment. If your pain is affecting your activity and has been present for more than 2 weeks, book directly. Every week of delay is a week of deconditioning, compensatory movement habits developing, and the condition moving further from its optimal treatment window. There is measurable evidence for this. Soft tissue injuries assessed and treated within 72 hours of onset tend to respond faster and more completely than the same injuries addressed at 3 to 4 weeks, when secondary compensatory patterns are already established and the optimal repair window has partly closed. Myth 2. Sports physiotherapy is only appropriate for serious athletes with serious injuries. This belief prevents a large proportion of the people who would benefit most from ever booking an appointment. Sports physiotherapy is not defined by the severity of injury or the level of sport. It is defined by the context, an injury or limitation connected to physical activity, assessed and treated with sport-specific expertise. The recreational badminton player with chronic shoulder aching after smashing is the right patient for sports physiotherapy. The office worker who jogs 3 times a week and has developed persistent shin pain is the right patient. The 40-something who plays weekend futsal and has a knee that consistently swells the morning after is the right patient. The assessment is calibrated to your sport, your training load, and your specific functional goals. It is not benchmarked against elite performance standards. A return to sport program for a casual jogger returning to 30 minutes 3 times a week is built very differently from a program for a competitive marathon runner, even when both present with the same ankle injury. Neither is less legitimate than the other. Myth 3. Pushing through pain is a sign of commitment and accelerates return to sport. This belief is not just incorrect, it is one of the most reliable mechanisms for turning a minor injury into a major one. There is a real and clinically important distinction between muscular discomfort from genuine training effort, the metabolic burn of a hard workout, the delayed soreness of a session that challenged the body, and structural pain, which is the nervous system reporting that tissue integrity is being compromised. Pushing through muscular training discomfort is appropriate and productive. Pushing through structural pain, tendon pain, joint pain, bone pain, nerve pain compounds the tissue damage with every repetition. A minor rotator cuff overuse response pushed through for 6 weeks becomes a partial tear. A patellar tendinopathy dismissed as normal knee soreness and trained through a full season can progress to a tendon rupture in a subset of susceptible individuals. A tibial stress reaction trained through rather than rested becomes a complete stress fracture requiring 6 to 8 weeks of non-weight bearing. The work of sports physiotherapy includes teaching you to distinguish accurately between these 2 kinds of pain, so you can train as hard as your body genuinely allows without exceeding the tolerance of structures that are not yet ready for full load. The athletes who maintain the longest competitive careers at every level, from recreational club players to professionals, are overwhelmingly those who treat pain signals as diagnostic information rather than weakness to override. The link in the description explains what sports physiotherapy involves and how to find a qualified sports physio near you.